Hey everybody, today we're going to start off with one of the first things in a dosage calculation series that I'm doing. And today we're going to talk about safe medication administration. Just a few objectives of this session. We are going to definitely talk about the 6 rights of safe med admin. That'll lead us into a little bit of legal stuff. We are definitely going to talk about routes of medication, common abbreviations, trade names versus the generic, different forms that medications can be supplied in, definitely talking about the physician's order, and interpret information found on drug labels. So when you're thinking about medication administration, we need to understand that it involves many healthcare professionals. I hope you're already starting to think about the prescriber. That's the, doctor, provider, nurse practitioner, PA, if they have prescribing rights. They legally write the order. And then you have the pharmacist who's actually going to fill the order. And then you have us, you, the nurse who's going to administer the drug to the patient. Um, Everybody is responsible for accuracy. So from writing the order to the filling of the order of the medication and to the nurse who gives it to the patient, at every step of the way, we are all responsible for making sure that that order is correct. Everything about it is right before it goes to the patient. Because once it goes to the patient and they receive it, you can't jump back down in their gut and take it back, or you can't get it back out through IV. So just think about safety, and that's, part of this process. But also when we're thinking safety, we need to think about, we have to know what those medications do and how they're going to react with the patient so that we can anticipate what would be normal to expect as a side effect or when they're having a reaction. And we'll talk more about that when we get to pharmacology. We also need to know that at every point in that chain, there's opportunity to make sure that there's no errors or to identify an error. And if an error were to occur, please know that it must be reported immediately. You must assess the client for any adverse drug events, and you must complete an incident report and any required documentation in the client's medical record. As nurses and as all practitioners, we must know state laws, policies, procedures, and our scopes of practice. So as always, we know we have 6 rights of medication administration. Now, some texts, some resources, it can go up to 10 nowadays or 11, but we're going to focus on 6. And these are fundamental. And hopefully the graphic on the right, probably a little blurry to see here, but hopefully it kind of jogs your memory for some things. You've got to have the right patient. Okay, so we need to use our 2 identifiers. We're going to talk more about that a little bit later. You've got to have the right drug or right medication. We're going to talk about that more a little bit later. The right dose. Not all doses are equal, so you have to pay very important attention to that. It must be in the right route. If it's orally, it's orally. If it's IV, it's IV. And that could also be the form in which the medication comes. It must be the right time, and we're going to talk about that a little bit more. And then also write documentation. And you guys may have heard at this point that if you didn't document it, it wasn't done. So we're going to talk a little bit about documentation. All right, so let's talk about right drug and right dose. So right drug, one of the biggest challenges many students may have as they're learning pharmacology is the generic name versus the trade name. So let's try to make this just a little, break it down just a little bit. So basically your generic name is what's given for that medication, and that's standardized. Like everybody has the same generic name, and there is only one generic name. Now there are many, 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 many trade names for that one generic name. So I've provided you an example. We all know ibuprofen. It's an NSAID. That's the generic name. But the trade names for it could be Motrin, Advil, depends on the manufacturer. Another unique example when you start to get there is a hypertensive medication called lisinopril. And lisinopril could be Caterpillar, and those are all trade names, okay? Um, when you're looking at a label on a medication, I want you to know that one way you can identify the trade name is that you are looking for that registered symbol or the trademark symbol. And actually, trade names, they're easier to pronounce than the generic names too, most times. We do have to be very mindful as nurses um, and everybody about look-alike, sound-alike drugs, and there is a whole list of them. They get misinterpreted commonly in practice, which is why we have to know about them. Now, I do not I'm not one to ever be like, you need to memorize this entire list. We don't want you to do that. I want you to be familiar. You are going to learn these as you go along. But I wanted to give you an example. Humalog and Humulin. When you start learning about diabetes and we repeat it back in pharm and we're talking about meds, there is a difference between Humalog and Humulin insulin. Now, if you were to look at two vials that may look identical in color, maybe their labels are the same, differentiating between that log and lin. So that's just something I wanted to bring your attention. Next time you go to clinical, ask your nurses and the instructors, can we find some different kinds of insulin so you can kind of see that example. It is super, 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 super important. Right drug, you've got to check it 3 times. So there's lots of points at where you can check the medication, and in my practice and when I'm with students, and nowadays with medication dispensing systems and electronic documentation and scanners, we just go like this. We need to go get the medication from the dispensing system. That is going to be your first check. You're going to check it right there when you pull it out of it. We're going to look at it against the medication administration record in the computer. That could be time 2. And without fail, please don't bypass this. You need to check it before you give it to the patient, and nowadays that's that scanner. So you need to scan. Packages now are individual dose most times. Do not bypass the scanner. That is a safety measure because it will check you. If it's very common, how many of you have read a sentence and you're reading it aloud, but what you read aloud is not written on the page? It's because we kind of anticipate it. Our eyes see it, and a lot of that writing's really small. So 3 checks always. Now there's some other things that you're going to want to do. And again, once you start getting into a little bit of pharm or as you're going along in your course, you're going to start to just kind of make this route and routine. Always, always, always check for allergies. Now the scanners will catch it when you scan the patient's armband, but you always want to ask, do you have any allergies? And have the client state that. Always look at the label and make sure the medication is not expired. And never give a drug from a container that is unlabeled or has an unreadable label. We don't want to do that. When we're considering right dose, you nurses are responsible, okay? The providers are responsible for prescribing and writing the orders. Pharmacy is responsible for filling in the hospital, but you are responsible for administering that medication. And you have a legal responsibility to knowing if it's the correct dose, okay? So that's why you want to check that. And that kind of leads us into strength. The dosage strength indicates the amount of drug in a specific unit of measurement. That is why when we are having you practice dosage questions, we really want you to pull back and practice like this is the unit of measure, because 0.5 milligrams per capsule is not the same as 0.5 micrograms per capsule, nor is the capsule the same as a tablet. So you just want to be mindful of that. So as you're moving forward and you're looking at dosage questions or you're in clinic and you're looking at medications, being mindful about the right dosage and its strength. So let's talk about a couple of the right routes or forms of medications. The most common that you're going to be exposed to or come into contact with, especially very early on in your clinical experiences, oral medications. Um, these can be are administered or taken by mouth, and they could be solid or liquid. Common forms that you see are tablets or caplets. These can be scored, which means they can be cut in half. Tablets can be enteric coated, which means they have a coating on them and they don't provide as much upset in the stomach, but it's there so that it will dissolve in the intestine. You need to be mindful with enteric coated that you never want to chew or crush those. They are to be taken whole. Buccal tablets get absorbed through the mucosa of the mouth. That's in that cheek area. And then you have sublingual, and that's under the tongue. And again, you never want to swallow sublingual. With capsules, specifically, they can have a powder, liquid, or granules in them. You don't ever want to break, crush, or open those. When we're looking at SRXL, that's sustained release or extended release, what this does is it slowly releases a controlled amount of the medication into the body over a period of time. Liquids. Liquids can come in many forms. Okay, so an elixir is a medication in an alcohol solution. So elixir, I think liquor, then I think alcohol. If that helps you connect it. A syrup. This is a medication that's dissolved in sugar and water solution. So I think syrup, I think pancakes, and I think pancake syrup, and it's really sweet. Then you have suspension. And this is an insoluble drug in a liquid base. So basically like being suspended and floating around in that liquid. You also have parenteral medications. These, we want to have sterile technique. When we give those, they can be injected via a needle into the body or by various routes. The most common ones that you're going to see and learn about are IM, and that's intramuscular, and that goes into the muscle. Then you have subcutaneous, and this goes into the subcutaneous tissue. You have IV, this is going to go directly into the vein. And there are a few other ones, intracardiac, into the cardiac muscle. Intradermal, this is going to be beneath the skin, so those are those PPDs that we get. Then you also have cutaneous, and these can be administered through the skin or mucous membranes. So these can be topical, and that's when you're going to put something on the skin surface. Transdermal, this is going to be a patch or a disc that it gets applied to the skin. So maybe a nitroglycerin patch or a nicotine patch for our smokers. Inhalation method, this can be breathed into the respiratory tract through the nose or the mouth. Cutaneous medications, they could also have solutions and ointments, and these can go to the mucosa of the eyes, nose, ears, or mouth. Suppositories also fall into this category, and these can go into the vagina, rectum, or urethra. And that kind of covers it in a nutshell. So don't want you to remember, you're going to start to learn all of these, but right now you need to start familiarizing yourself with like how many routes and forms of medications are out there. And as you start learning as you're going along in the program, in your clinic experience, you will start to get very familiar with these. All right, so when we're looking at right time, this is really, really important. Okay, prescribers are going to order how often they want the medication to be given, and there is a reason for that. If the order is every 12 hours for an IV antibiotic, and you cannot give that every 12 hours on schedule, ask yourself this. Is the medication doing what it's supposed to do therapeutically all of the time? Probably not. So it is imperative. when we're thinking about right time, one of the nurse's responsibilities when we're thinking about pharmacology a little bit later down the road is you need to know if this medication should be given before or after meals. So as you're moving along, when you get there, I always want to ask yourself, can it be given with food, before meals, after meals, or it doesn't matter? Um, Medications can be ordered a variety of ways. We will talk about a few the orders you commonly seen, but when we're thinking about a frequency, timing, daily, twice a day, 3 times a day, 4 times a day, those are pretty common. And some facilities will even have certain times. So if it's 3 times a day, they may say, it's 8 o'clock and whatever's 8 hours after that and 8 hours after that. But maybe another facility, their 3 times a day starts at 9 a.m. So you always have to follow your policies and your procedures. We want medications to, let's go back to why it's so important, to be stable for the patient. Drug needs to be therapeutic. If drugs are scheduled at regular intervals, you really want to maintain that schedule unless there is some outlying reason. It's going to affect their concentration in the blood. It's going to affect how those medications work with the patient, and how they are receiving that treatment. And ultimately, our goal is to get our patients, with their plans of care to an optimal state of wellness that they can be. So we want to make sure that we have the right time every time. Future nurses, all of the rights are extremely important. There can be an error if you do not do any of these, but I think these two are critical. Right patient. You've got to give the right med to the right patient. So you have to know who you're giving medications to. It is your responsibility because you are the last stop before that patient receives the medication. And if you are in a facility that has 2 patients in a room, and let's hope this never happens to you, you have John Smith in bed A and you have John Smith in bed B. Let's hope that never happens, but you've got to find a way to identify them. So, period, point blank, you have to have 2 identifiers at least. That is JACO. So, patient, name, date of birth, medical record number, all of the above, those are the things that you want to use. Never, never, oh, the room number. No, 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 because patients move around rooms. So name, date of birth, medical record number, those are standard, and use those scanners. I cannot say this enough. I know, and I don't know if you've seen it yet, you go into a facility and we have the armbands. Well, if a patient's been in a hospital for a while, they tend to fall off. Then get a new one, or they tend to crinkle and they don't scan anymore. Get a new one. You don't bypass the electronic system. Documentation. Always, always, always document. We can't tell you this enough. And there's going to be lots of things you document besides you gave that medication and at what time you gave it. You may have to enter in vital signs. You may have to enter in allergies if they may have had anything. If you are not an electronic documentation, write legibly. Does no good if nobody can read it. And again, I have to tell you, if you didn't document it, it looks like it wasn't done. So always, always document. And this is going to lead us to abbreviations. Okay, there are a ton of abbreviations out there that we use. Some are okay to use. Some are an absolute no. And again, this is the Joint Commission. So I'm just going to give you a couple of examples. And I give these examples because I see them when students are doing dosage problems. And unfortunately, if you were to put U, just a letter U for the word unit, like unit of insulin, that's incorrect. You cannot use a U. It gets mistaken for a 0. The abbreviation QD, which means daily, that can get misinterpreted. So write out the word daily if you're doing writing anything that you need to denote that. And then again, the leading and trailing zeros. If you have a leading 0 and you don't need it, it could look like the number, especially in written orders, is incorrect. And trailing zeros, that could just make your unit and the amount of medication you give completely wrong, and it could be lethal. There are many, 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 many more abbreviations. If I were to give you any advice right now in the course that you're at, is look at the do not ones first, because you don't want to start getting yourself into a habit of using unapproved abbreviations. So medication orders, these are extremely important because this is what we do as nurses. We carry out the orders. So when we get an order for a medication, I should have put this up at the top, but all orders must be complete. They have to have a drug name, they have to have a dose, they have to have a route, they have to have a frequency. Those are the main components. So if, for example, you ever get a verbal order or telephone order that you have to transcribe or enter into the computer, you've got to get all of that information. Common orders you're going to see are verbal or telephone. Now, we don't do these a lot anymore when we've gone to provider order entry systems where the providers put in the orders. But you do need to know they exist, and there's certain things you're going to have to do if you ever have to write a verbal or telephone order into the client's chart. Routine orders. These are most common. Okay, this is what the provider is going to write, and it's going to stay that way until discontinued or to a specific date. A standing order may also be known as a protocol. These are orders that providers put in place so that if a client changes or if something happens, you as the nurse can now institute whatever medications that may be needed based on the client's condition. PRN, or as needed, these are going to be given, you're going to have a list of them for your patient. So if they're nauseous, they can have this. If they have pain, they can have this. You need to know that PRN orders, they have to have a time. So like every 4 hours, every 6 hours, and you have to have a reason. Stat orders, these are the ones that are going to come in emergency situation. So it's going to be give this medication, this amount, like 80 milligrams IV stat. That would be give it right now. All right, so let's do a quick quiz. And I know the label's a little cut off here, so I have already put this label and the questions in the MDCC discussion forum of your Blackboard course. And, why don't you let me know if you can answer all these, or let's talk about them. So here's what I want you to do. And you can pause the video, you can take a look at it, you can go look in the discussion forum. You should be able to take a drug label, tell me what the trade name is, the generic name, what is the dosage strength, what is the route. Another question, is this a multi-use container or is this a single dose container? Something to think about. And then bonus, can you tell me what you need to know as a nurse with this medication? And I don't want you to go look it up in the drug guide and tell me the nursing considerations. I want you to look at the label because there's some really good information on there. So I hope to see your posts in the forum. Hey, we've made it to the end of this session. I want you to know that if you have any questions about this presentation, please go ahead and post your questions in the medication dosage calculation competency forum of your Blackboard course, and I will be checking that frequently. So thank you and have a wonderful day.